Hi, and welcome back. I'm Dr. Megan. We are doing office hours today. I am back from vacation. I had COVID on vacation. It was not fun. I hope nobody else is going through that. But we are going to make it work today and go through some questions. So let's get started. If this is your first time, welcome. If you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. I'm Dr. Megan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And I'm also a certified life coach. But this is really important because I actually prescribe these medications. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So without further ado, let's get into the questions. Thank you so much for sending them in. If you have questions afterwards, feel free to leave them in a comment on this video, on other videos. I'll find them. I love answering your questions. You always have very thoughtful, very insightful questions, and they are so helpful for everybody listening. So keep them coming. And if your question leans a little personal, I can't answer personal questions because I'm not your personal doctor, so I might change it a little bit to make it more broadly educationally applicable. And let's get started. All right. So does anyone who's taking this is talking about Mounjaro, anyone who's taken this had side effects of thoughts of self-harm, asking for a friend who has been on this for a year now and lost 60 pounds, but also had thoughts of self-harm. Okay. Wondering if this drug could be the root cause. That is a great question. So, as a side note, if you or anybody you care about, you have emergent concerns about self-harm or thoughts of suicide or anything like that, it's really important to reach out to a medical professional immediately. And also, I will leave the link to crisis hotline below. If we're not talking about an emergency situation, this is going to encompass this question. And so in the absence of any emergency situation, so usually on these medications, meaning Mounjaro, tirzepatide, Wegovy, semaglutide, Ozempic, Zepbound, on these medications, generally when people are losing weight, their mood gets a lot better. They find that they can move more, they can exercise more, they can see progress with their weight loss. So overall, the vast majority of people, their weight goes down, they're feeling better, they're moving more, and their mood improves. However, there is a small subset of people, and this is now being more investigated, that their mood might get worse. I've seen this maybe a few times personally in my clinic, but every once in a while somebody's mood gets worse or they have thoughts that they didn't have before about their mood. So it can happen, but it's rare. But if people have, if people are having just something for people to be aware of, especially if people have, mental health issues in their problem list already. If somebody already has mental health issues, especially you want to be aware of this, but it's not, I would say, limited to that. Anybody who has a history of serious mental health issues, hospitalization, anything like that, of course, that's always going to be a big caveat in terms of prescribing and things to look out for. But just for anybody who's on these medications, good to be aware of any change in mood that's kind of outside the norm for them. So definitely something to be aware of, something to look out for. And if this was your friend, I would definitely, anybody having a change in mood like that should definitely talk to their prescribing physician right away. And of course, for any emergencies, 911 crisis hotline, all those kinds of things. But yes, can, in rare circumstances, people can have changes in mood that we don't anticipate and that are not favorable. So, great question. Thank you so much for asking. Okay. Next question. It is being said that Ozempic and Mounjaro help with lipedema inflammation, which is great because so far there hasn't been any medication for it. But also there are other side effects. I'm changing this one a little. So people who have other side effects from weight, like ulcers and acid reflux, it might be kind of a contraindication. So this is a question about kind of balancing the two. And so for anybody who's not aware, lipedema is it's a disease of fatty tissue, in which fatty tissue, subcutaneous, more superficial as opposed to visceral, kind of that internal around the abdomen, around the internal organs, that's visceral fatty tissue, as opposed to subcutaneous fatty tissue, which is that, more, you can see it, you can feel it, fatty tissue. So it's an abnormal deposition of subcutaneous fatty tissue, predominantly in the lower extremities, in the lower legs. So most things that help with weight loss are going to help with lipedema. So yes, of course, anybody who has lipedema should definitely chat with their physician to see if an injectable GLP-1 receptor agonist is going to be an appropriate treatment for them. But yes, there are also contraindications for that. Now, thinking about the other, the downside of these medications, they can definitely make reflux worse for some people. But they can also, weight loss can also really help reflux. So I don't necessarily see reflux or GERD as an automatic contraindication because sometimes it gets better. So anybody who has reflux but also feels like they might really benefit from these weight medications, I would definitely recommend, don't count yourself out of the running for these medications. Talk to your prescribing physician, talk to your primary care doctor, or see an obesity medicine physician, because there are definitely things you can do, you can play around with. And also you can do a very slow titration as well, just to make sure that these symptoms don't get worse. Now, they might, you might talk to them, and depending on somebody's individual case, there are going to be people that it's really not a good fit for. But I think for people who have reflux, it's often definitely worth a try because sometimes it can get a lot better. So don't count yourself out if that's you. Talk to your physician. There's ways around, other medications you can take. There are, you can certainly do a slower titration, and, there's lots of options on the table. So worth exploring further is my point. All right. So that's a great, okay. This is great. I set this up back to back and I didn't even realize this. Okay. So this is a question about the side effect hacks video. Somebody is wondering whether Tums or over-the-counter GERD medications are okay to take. Yeah, I mean, as always, and I can't answer a personal medical question, but usually Tums would not be contraindicated with these medications and can certainly be helpful to get people over that, if they're having an adjustment period and they're having some reflux. And then I will Certainly sometimes use Pepcid, or if somebody's having a lot of reflux, something like omeprazole or pantoprazole, or something that's a prescription strength acid suppressant to help with if someone's having really bad reflux. You have to be careful with reflux, because what you don't want to do is just take it on your own and not tell anybody, because you want your prescribing physician to be aware that this is coming up for you so that they can help you manage it. What you don't want to do is just take these medications on their own, not tell anybody. Also, you want to make sure that you're taking them correctly. They have to be taken in the morning before any food. But also, it's important because for people who can't wean off the medications, that is sometimes an indication that you need to keep a closer eye on their reflux, or that might be someone that needs an endoscopy, like an upper GI scope. So the short answer is usually these are fine and can be very helpful with managing those symptoms. The longer answer is you definitely want to let just keep your physician in the loop and have a conversation about what's going to be the best. And then also, obviously these medications, if you weren't on them before you started the medication, the injectable GLP-1 medication, if you weren't on them before you started, you want to have a plan for when you're going to come off of it, or if you can't wean off of it, what does that mean for you going forward? So these are all questions to have with your doctor. But that is an excellent, excellent question, and can really help a lot of people, especially during that transition or titration phase, as they're getting up and running on the medications. Okay. Can you take half of 0.25 of Wegovy? This is someone who's might be having a lot, for anybody who's having a lot of side effects with that initial dose of Wegovy. I wouldn't advise, because you don't really know how much you're getting if you stop the pen halfway through. My preference is for people who are having a lot of side effects with the earliest dose. Number one, get really specific about your side effects. So what are they? And also, when are you having them? Are you having them all the time, or are you just having them for that 24 to 48 hour window after you do the injection? Or maybe some people, they're like, I have side effects for 5 days and then I can really feel the medication wearing off, and by day 7 I'm fine again. Just get really specific about the type of side effect and the duration of the side effect, because then your physician is going to be better able to help you manage it. I think it's easier to manage the side effects and do a slower titration than it is to kind of try to figure out if you're actually getting the dose. I feel like if you're stopping it halfway through, it's going to be harder to kind of continuously give yourself the same amount, and it's such a small dose. And the goal of that earliest dose is not weight loss. I'm never expecting anybody to lose weight on that 0.25 of Wegovy. I am expecting that this dose is really just to help their body get used to the medication. The bottom line is, I would much rather do a slower titration and manage the side effects and see if somebody's body gets used to it, or if things are manageable with help like Zofran or Pepcid or Imodium or whatever's going on for somebody. I'd rather just keep them on the lowest dose for longer, because a lot of times it goes away, whereas I really don't know what dose they're getting if they are kind of stopping in the middle. So that's my preference. Your physician might have a different preference, but that's always where I'm going to err on the side of. And there are some people that, even on the lowest dose, they're just so miserable, and you try and you try and you try, but it's just not a good fit. And so those are also people that, they may have better luck with Saxenda, they may have better luck with Zepbound, because there is certainly some you're to have a different personal response depending on, just because they're in the same class doesn't mean that your reaction is necessarily going to be exactly the same for those medications. So that's going to do it for today. Thank you so much for watching. Thank you so much for your questions. Please feel free to leave questions again in the comments down below or on any of the videos as they arise. If you want to work with me directly, I will leave that info down below as well. Thank you so much for watching, and please be well.